Hey guys, and welcome back. I'm making this video to share with you the 3 most common causes of fatigue that I saw in my medical practice. And this is based on me as a functional medicine physician seeing thousands of patients over a 10-year period of time. My name is Scott Resnick. I'm making these videos to make you best stewards for your own health care and to teach you to turn around your health without using drugs. So the 3 most common causes of fatigue are as follows. Number 3 is probably a subclinical infection. Uncommonly, I saw people with, say, like a chronic bladder infection that had not been identified by their doctors. More common than that was an oral infection, such as an abscessed tooth or ongoing gum disease. These chronic inflammatory states drive a sense of fatigue. And of course, there are some of these chronic illnesses, such as Epstein-Barr virus that's been reactivated. This is the virus that causes mononucleosis, and also Lyme disease. So if you live in a part of the country which is endemic for Lyme, it's important to have your doctor do a check and make sure that you've not been bitten by a tick, which is contributing to your fatigue. So number 2 has to do with food sensitivities. I know this is pretty simple, but many of us are consuming foods on a regular basis to which our body has been sensitized. So this isn't a food allergy, but a food sensitivity. Typically, these are foods that we consume day in, day out, and have done so for a long period of time. Having checked thousands of these food sensitivity tests on patients, I can tell you that the most common foods were eggs and dairy, gluten, soy, and any number of different nuts. So if these are foods that you're consuming on a daily basis, why not try to just pull these foods out of your diet and see if that makes you feel better? And cause number 1 for fatigue deals with our adrenal glands and the way that we are handling cortisol. Now, this is a lecture in itself. There's hypercortisolism, too much cortisol, hypocortisolism, too little cortisol. I can tell you that people who get into the low cortisol state typically complain of pretty significant fatigue, and this is a heaviness that seems to follow you in your body and your mind through the entire day. But what's important to remember is that cortisol is vitally important for the way that our insulin works and the way that our thyroid gland works. With disordered cortisol responses, we tend towards higher levels of insulin, which deposits more fat, and fat itself is inflammatory, which contributes to fatigue. Additionally, cortisol dysfunction makes our thyroid gland not work so well, and so many people who I saw in my practice were in a relative state of hypothyroidism. In other videos, I will teach you how to measure the cortisol, how to understand your insulin, and how to measure thyroid hormone correctly. But for now, I just want to give you these 3 broad categories and have you take a moment to consider whether you might be at risk and need to do more testing to learn more about yourself in these categories. Of course, I'm making these videos for you. I want to collectively work with you to help to turn around medicine to one which is based less in diagnoses and choosing drugs and more towards using a systematic, science-based approach to really turn around our health and to get us better. Of course, if you like this video, be sure to comment. If we're on YouTube, subscribe, leave a comment. I'll be sure to respond to all of your comments personally. And I will see you in an upcoming video. Be well.